For more on this, let's bring in Dr. Aileen Marty, infectious disease specialist and outbreak response expert. She joins me from Miami Beach, Florida. Thank you so much, first of all, for joining us today. I want to talk about what we heard in that report. So small gatherings during Thanksgiving, not recommended, but we are, of course, in the middle of a campaign, a presidential election campaign. President Trump is hitting 5 different swing states today. His rallies, not small gatherings, and often we're not seeing a lot of people masked up at those rallies as well. This at a time when the U.S. hit over 90,000 cases this week, the highest in a single day. What are you hearing from your medical colleagues on this? What are you feeling?
Well, it's absolutely frightening. And I think people need to bear in mind the power of peer pressure. And if you look at the Stanford study, for example, that recently reviewed what was going on and did the serious math that showed undoubtedly that these types of mass rallies where people have the wrong message broadcast to them and they have the peer pressure not to have the physical distancing or the use of masks is an absolute nidus for spreading this infection. And here in South Florida and in Miami, we recognize that our cases are going up more by the data of the patients coming to hospital with symptoms of respiratory illnesses and then proving to be COVID-19 patients at a rate that is clear that the actual published data about our rising numbers is inaccurate. In other words, we have a much higher viral load problem here than published reports would indicate.
Right, and that Stanford study that you were just citing there, it has not been peer-reviewed yet, but it says that 30,000 cases and over 700 deaths can be traced back to rallies that Trump held in 18 different cities. And so what are you expecting to see after Tuesday?
Well, our data, our analysis, our reproductive number, RT, has been going up steadily over the last week and a half. We're now well over 1. So even without these rallies, we were going to be seeing an increase in cases that was going to have a notable impact by mid-November. With these rallies, with individuals who participate in these kind of peer pressure to not pay attention to the virus situation, that is going to be edged at a much higher logarithmic rate, and that in turn will bring more problems to our community, not just the horrific problems of health, long-term comorbidities and death, but also economic damage. It is a foolish thing to be doing.
Now, Biden is saying that if he wins, he will not shut down the economy. He will shut down the virus. That's been his main line. Is that still possible?
We have to recognize the basic principles that are clear from how this virus is transmitted. There are ways to maintain the economy and halt transmission. Obviously, if things go completely amok, as they can go if we don't pay attention, then unfortunately it might be necessary to put some brakes on the economy. But it's still not too late if we all are willing to follow the basic public health guidance that reduces transmission.
And hopefully things do change for the better. From Miami Beach, Florida, Dr. Aileen Marty, infectious disease specialist and outbreak response expert. Thank you so much for joining us today.